Hello, my name is Cameron Pressman. Today we're going to talk about abdominal pain and abdominal assessment and how important it is whenever a provider is talking to you about it, and how honesty is going to be a big thing. Abdominal pain is going to be hard to see, so we're going to rely on a lot of patient information. And it can be scary for a patient. Some of the things that we're going to talk about first is observation, auscultation, percussion, and palpation. We'll talk about those a little in detail a little bit later. The abdomen region is broken down into 9 different regions. So whenever we're talking about abdominal pain, we need to know where it's going to be at. The big thing I want to cover today is how important it is when we ask a question, honesty. And it's going to be eerie for a provider talking to a patient, and how it can be sensitive to the patient, or it can be an eerie feeling. So let's just, we're going to focus on answering questions properly, because it's going to determine our treatment and what exactly is wrong. There's 100 different diagnoses that are caused from abdominal pain, so we need to definitely narrow that down. So observation is the first thing. So either when we're talking pre-hospital, as a paramedic comes into a house, or you're sitting in the physician's office, observation could be a big thing. We're going to look at the patient, we're going to look at how they present. If they're in pain, you can see that the presentation of the skin color, so that's a big thing. So a lot of information can be gathered from that. We definitely have to expose the abdominal, and that's where you have to cross the line, and you have to be professional. It gets a little uneasy for the patient and also the provider. So we have to get it off. We have to see the area we're working on. So just be prepared for that as a patient or as a provider. It just crosses the boundaries in that comfort zone. So the next thing we're going to talk about is auscultation. Now, what auscultation is when you listen with a stethoscope. We're going to listen over the abdomen in the stomach region. We're going to listen for different sounds. We're going to listen for bowel sounds, see if they're present, see if make sure they're there. What sounds are frequent? If the sounds are frequent, scarce, or absent, will tell us a lot as a provider. And what is the nature of the sounds? Now, again, this is the first time we're going to actually put hands on a patient, so again, it's going to make it a little eerie. Make the patient feel uncomfortable, but as long as we come in and we talk about that, that's why we're trying to give a little knowledge to a patient out there. The next thing we're going to talk about is percussion. What percussion is you're going to listen for if there's blood or air in the stomach. So certain regions of your stomach will make different sounds. Your liver, which is here, will make a little different sound because it's an organ filled with blood. So it's going to make a thud sound compared to like your stomach that's hollow or your lungs that are hollow. So you'll see a provider or the physician take their hands, put the hands over the abdominal, and use a percussion sound. You take your hand and then you'll thump. So that'll determine whether the blood's in the wrong place, or if we need to know where it's at, or if we have a bleed of some sort, or we have air in the stomach. So the last thing that the provider or the physician is going to do is palpation. What palpation is we're going to put hands on the patient. We're going to feel for a tenderness area. So, like I said, the abdominal is broken down into 9 different regions, and with that, we're going to ask the patient what region hurts the worst. So when we do this, we want to start in the opposite end. So if they're complaining of pain in the bottom right region of the patient, we want to start in the top left. That way, the top right, and work in a clockwise rotation. So we touch the pain and tenderness area last, because if you do that first, you're going to lose all sorts of, A, your trust in your patient because it's going to hurt them, and B, then they're going to have pain all over because you radiated that pain through the stomach. So again, we're going to palpate the tender or pain area last, and we're going to work in a clockwise position. So again, this is the 4 steps that you'll see mostly every physician or paramedic that comes in your house is observation, auscultation, percussion, palpation. So hopefully, as you as a patient ever have abdominal pain, this is the steps that they're going to do and why they have to do it. And this is my presentation. Thank you.